We're about to start the video on a head-to-toe assessment on my patient. His name is initial JH. He is a 48-year-old male, approximately 175 pounds, and about 6 feet 1 inches tall. He has no specific chief complaint at this point. However, when we're doing our assessment, certain things may come out at that point. At this point in time, Mr. JH, I'm Heather Haynie. I'm a student, a Bachelor of Nursing student, and I'm about to do your health assessment.
Yes, ma'am.
Okay.
Actually, I'm feeling very well.
Okay. And starting with, kind of give me a little bit of your background in terms of your health-wise. Have you had any kind of childhood diseases or anything of that sort of nature? Just give me a little background. Have you ever had chicken pox? Have you ever had measles or any of that nature?
Chicken pox, measles, I had. Health-wise, just I have anything negative with health.
Okay. What were your activities? Were you athletic type activities? Have you ever played kind of sports, or were you strictly more or less someone that sit around most of the time?
No, ma'am. It's just the thing is me. It's just athletic.
Mostly athletic.
Athletic. I can do it all: basketball, baseball, football.
Okay. I'm about to do an assessment on patient. It is name is JH, and he is a 48-year-old male, African American male, approximately 175 pounds, about 6 feet 1 inches tall. Very good nutritional status. Married with 4 children. Occupation as a truck driver. He has he really does not have any direct complaint at this point. However, we're going to do a complete head-to-toe assessment, and we're going to start with some general questions. Mr. JH, what is your general health today at this point? How do you feel today?
My last assessment with DOT.
Your DOT physical?
My DOT physical came out perfect.
Perfect DOT
Perfect.
physical.
And actually, I just done that in the last month.
Okay. And what is in that physical that they went ahead and did check your heart, your lungs, and those type of things?
No, ma'am. They didn't do that. They just checked the regular DOT physical standards.
Okay. All right. Well, let's go ahead, and I'm going to go ahead and start on working on doing a head-to-toe assessment. Let me go ahead first. Let me get some vitals. Your body temperature at this point, we're going to say is you have no fever. Your body temperature at this point would be, say, 98.6. I'm going to go ahead and do check your blood pressure. What's normally your blood pressure usually runs?
I'm not sure, but normally it's they always tell me that it's real good.
(115/78). Very good blood pressure.
Thank you.
Okay, at this point, let me check your pulse. Pulse is at 92, which is not bad. As long as it's between 60 and 100, it's really good.
Okay, thank you.
Okay, what I'm going to do as well is to, let's start with your head. We're gonna feel behind your sinuses. Is there any pain there?
No.
No pain?
What do you mean with my sinus?
This is, your sinuses are areas here that has, it's like an open space that helps the head so that your head will not feel heavy or anything. These are areas that can actually have, can become infected when you can actually have sinus infection, and most of the time you feel like a little pain if I'm pressing on here.
Mm-hmm.
Okay. Are you feeling any pain along here?
No.
Okay. What about here?
No.
In your scalp? No pain?
No.
Okay. Now what I'm going to do is also start now here, behind here. This is your lymph, the cervical chain, your lymph nodes is the preauricular. Okay. And your postauricular. Come down here. This is your cervical chain. I'm going to do the submandibular. I don't feel any lump, any kind of swelling, or anything like that nature that would indicate some kind of, like you have an infection of some sort. Okay. I'm going to go all the way down. Okay. Right back here is the occipital. And at the same time, I'm checking your skin. I'm doing a visual on your skin to make sure that there's no lesions or any kind of rashes of any sort. Okay?
Yes.
And so far, everything looks pretty good. Okay? Now, what I'm going to go ahead and do, I'm going to go ahead and check for your, I'm going to check the cranial nerves about your head. Okay? And they're starting, what I'm going to start with, the cranial nerve for the first one is the cranial nerve number 1, which is the olfactory. Okay?
Yes.
Okay, I'm going to have you to smell something. Okay. Close one nostril. Can you smell that? Okay, close the other nostril. How's that? Okay, cranial nerve number 1 is good. Cranial nerve number 2 is the optic nerve in the eye. I'm going to go ahead and shine a light in your eye, okay? I'm going to take a look. Okay. That was cranial nerve number 2. Cranial nerve number 3. Cranial nerve number 3 is the oculomotor, and that will cause your eye to move. Okay, and that's cranial nerve number 3. Cranial nerve number 4 is the trochlea, and cranial nerve number 6 is the abducens muscles. Those are the muscles that move the eye. So what I'm going to do is to see if your eye is going to move from side to side, up and down. So let's follow my finger. Okay, so far cranial nerve 3, 4, and 6 are fine. Let's do cranial nerve number 5. Cranial nerve number 5 is a trigeminal, and that one that is going to let me see if whether or not you can feel these areas. Okay? Alright, so I'm going to, this is like a little straw right here. Okay, let's see. Can you feel that?
Mm-hmm.
Okay. Cranial nerve number 5. Cranial nerve number 7 is the facial nerve. I'm going to take this cotton ball. I'm going to mark it across your forehead. Can you feel that?
Yeah.
Can you feel it at?
Yes.
Okay. Okay, cranial nerve number 8 is the acoustic, and that is your hearing. Okay? Now, I don't have a Rhine-Weber tuning, but what I'm going to do is whisper, and you tell me if you can hear. I'm going to close this ear.
Yes. Yes.
Okay. Now what I'm going to do is check. I'm going to go ahead, let me tap this. Do you feel that? Is it vibrating?
No.
Okay. This is, normally I would have like a tuning fork where I would tap it and put it right behind your ear, and you can feel the vibration from the tuning fork. Or I will have it and I'll put it at your ear, and that would allow you to hear, see if whether or not your hearing is really good. That tuning fork, you will hear the sound as it gets weaker and weaker and weaker. That will tell me how good your hearing is. Okay? Now, the next one would be cranial nerve number 9. Cranial nerve number 9 has to do with cranial nerve number 9, 10, and 12 are the ones that have to do with the mouth. Now, those have to do with the mouth, manages the tongue and the swallowing, and allows you to be able to stick out your tongue, move it from side to side. So let's go ahead and try that. Open up and say ah. Okay, okay, open up. Okay, stick your tongue out. Okay, move it from side to side. Okay, and stick it out even further. Let me look at your uvula. I need to look all the way in the back. Uvula is centered. Okay. All right. This is cranial nerve number 11. I'm checking. I'm pressing down on your shoulder. Don't push back. Push back up. Push again. Okay. That's to ensure that cranial nerve, these are the spinal nerves that's coming off your spine. Make sure that your shoulder muscles are actually being able to be innervated by that nerve. Okay? that takes care of cranial nerve number 1 through 12. Okay, next I'm going to look at, I'm going to check your neck. Check for the muscles. I'm going to check for any kind of bruise. Check for the jugular veins. Feel any kind of pain or anything? This is your clavicle here. Okay. Alrighty. Now, the next thing that I'm going to do is to check with, let's see, what's the next one we're going to do here is to check your lymph nodes. Okay. For your neck, I want you to turn your head from side to side. Okay. Okay. Neck muscles are working fine. Okay, since I'm getting close to your face, I'm going to be having my hands close to your eyes, I'm Mr. JH. I'm going to go ahead and take a look. I'm going to open your eyes. I want to see if your pupils are going to be constrict with the light, meaning that the pupils will close when there's too much light, so that it shows that it's actually innervating. And these are part of cranial nerve number 3, 4, and 6. Okay? Yeah. So let's check. Okay, and I am going to look, let's look down in here, see the conjunctiva. Okay. Okay. Now, okay, so that was good. Now the next thing that I'm going to do is let's go ahead and check your hearing. I'm going to look down in your ears. I need to look down in your ears. I'm going to check your ears. Pull up on the pinna. Okay, I'm looking to see. I would be observing the tympanic membrane. That's what they call the eardrum. And that is to make sure that it's a pearly gray color and a shiny pearly gray. If there's any kind of, I will be looking for to make sure there's no lesions, no abscess, or any kind of infectious activity inside the ear canal. And I'm also looking at the outer ear, making sure that everything is even, symmetrical with your eyes. Okay. Nose. Let's do your nose. Let's check inside the nostril. Check it to make sure that the septum. Okay. Now the next thing I'm going to do is your lungs and your heart and your thoracic. So what I'm going to need you to do is take your shirt off. You can take your shirt off for me. Next thing I'm going to do, Mr. JH, I'm going to go ahead and listen to your, I'm going to listen to your lungs and see whether or not you have any kind of wheezing, crackles, rhonchi, anything of that nature, any kind of fluid in your lungs. Okay? So I'm going to listen to your lungs. I'm going to start from this area, go all the way down. Okay? And then I will go ahead and do it on the back to make sure that we're doing equally, to see where each area is, to make sure that there's no, you do not have any, if there's any kind of pneumonia or anything of that nature. Okay? So, starting with the front. Give me a deep breath. Now I'm listening to the top part of the lungs to make sure that, okay, give me another one here. These are vesicular sounds. This is a bronchial sound. Okay. Okay. Okay, what I'll need you to do is turn around for me. You can stay on the bed. You can stand up. You can stand up. Okay, I'm going to go ahead and listen to this. Give me a deep breath. And what I'm listening for, these are bronchivesicular sounds. And that is to ensure that I don't hear any kind of okay. I'm going to also listen, have you speak, and when I hear the vibrations, you can have a seat. And the vibrations, that is called tactile firmitus. And what I want you to say is 99. Say 99.
99. 99. 99. 99. 99. 99.
If there was any kind of, if you had any kind of obstruction like a edema, or if you had pneumonia, it will have a different sound. I probably will not hear you say 99. Okay. Let's see. Next thing is, let me see. Let's see. Also want to look at listening to your heart. Okay. Now, listening to your heart, I'm going to be listening for any kind of no, let's go back. Let me listen. I'm going to listen to any kind of resonance in your lungs. Okay, so let's listen. That means that the lungs is filled with air, so you hear like a resonance. Okay, you can turn around that way. Turn you back to the camera, so that turn you back to the camera. Okay. That's because I'm hitting the scapula. The scapula here, this bone, it sounds very dull. So I come here, and you hear the sound, and that's all part of just lung tissue, and the lung is filled with air. Okay. When I hit here, it's very dull. Okay. All right. We can turn this way. Okay. Now what I'm going to do next is I'm going to listen to your lungs, your heart. I'm going to listen to your heart. Okay. Now I'm going to start here. I'm going to start here listening to the aortic, then I'll listen to the pulmonic, and then I'll listen to the mitral, the tricuspid, and the mitral valve. Okay, so here, let me listen. Okay, heart has a regular rate, regular rhythm. Here is the pulmonic, and at the same time, this is Erb's point. This is a tricuspid here. This is a mitral down here. Okay. Okay. Next, we're going to Read. Let's go ahead and read the eye chart. Read the lowest line that you can read. Go all the way and read the lowest line.
Which eye?
Start with the right eye.
Do F, D. It's like this one on me. I can't see anything now. Can't see that now.
Okay. Go to the next one at the top.
L, E, F, O, D, F,
Okay.
C, T.
Okay, and that eye chart will designate how good your eyes are as far as what you see several feet away. So say for instance that you will see what you will look at one line that will indicate what you will see at 20 feet away, at 50 feet away, and that will give you exactly what your eye your vision level is, whether it be 20/20, 20/30, or such like that. Okay. Okay, let's do your abdomen. Now you have to lay down for that. Okay. Now your abdomen, I'm going to inspect it to make sure that there is, and then I'm going to listen. First I'm going to inspect, then I'm going to auscultate it, and then the last thing would be to percuss, palpate. I'm going to palpate to see what it is. So I'm going to listen. I've inspected. You listen. Active bowel sounds in all four quadrants. Okay. I'm going to try to feel for your liver. Okay. I'm going to feel for your liver. Okay. Let's see. Don't tense your stomach out. You can't tense your stomach. I gotta be able to keep up. Okay. This is check for your spleen over here. Okay. 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 Let your liver span at this point. Okay. You can sit back up. Let's do your musculoskeletal. Okay. So musculoskeletal is to check to see. I'm going to check your tendon. Okay, we're going to check your tendons. First I'm inspecting your skin to make sure, and check your hands. You have a scratch on your hand. These scratches are in different stages of healing. Okay, and more than not, these have scabs that are approximately 2 weeks old. Okay. Okay. Skin is warm and dry to touch. Okay. Now let's see. I'm gonna do the Allen test to test your arm to make sure that these arteries are working fine, that there's no blockage or any kind of occlusion. You've got good circulation in them. Close your hands for me. Okay, release it. Okay. Oh, this one. Okay. Try this again. Okay. Okay, see your hand is starting to pink up here. That means that this artery here, this is the, that artery is, okay, let's try the other one. Okay. Open your hand. Okay. It's actually pinking up. Alrighty. Let's try the deep tendon reflexes. Got this one here. Let's check your. This is supposed to elicit a response. Let's try the other. Okay. Tendons are working. Let's try the I'm going to check to see where placement. Let's try the other one. Okay. Let's try this. This is the Achilles. Tendon. Okay. Alrighty. So that is part of the musculoskeletal. Let's see the others. The other tendons were shoulder. Mentally, that you're alert and are aware of your surroundings. Okay.
Start from the top here.
Okay, we're going to be doing a neurological test now, and that is to check to see if you have you are aware and alert. Mentally, to know where you are in your surroundings, that you are you're aware of where you are, your time and place. Okay, so first I'm going to do a mental test. It's called, one of them is called a mini mental test, and that is to see if you can remember certain things. I'm going to count some numbers, and I want you to count them after I say it. I want you to count them backwards, okay?
Yeah, backwards.
Yes. 8, 6, 5, 4.
5, 4.
Okay. Okay. Hold on a second. All right. I want you to stand up. Okay. Put your feet together. Okay. Close your eyes. Okay. I'm doing a Romberg test and see whether or not you maintain your balance. Okay, put your hand to your nose. Okay, remove your hand. Put your other hand to your nose. Okay, put it back. All right. Hold this. Hold this and tell me what it is. This is. Don't look. You have to tell me what it is.
Paper clip.
A paper clip. And what is this other item I gave you?
Pin.
Okay. And that is to test to see. It's called sturgionosis. Sturgionosis. And that is to know what an item is. What an item is without looking at it. Okay, you can open your eyes. You can sit back down. Okay. Other than that, everything else seems to be fine. Let me do one last test. Okay. You can lay down. Okay. I'm gonna tickle the bottom of your feet and see. Okay, that is to make sure there is a negative Babinski, which means that if there is, your toes actually should curl as opposed to moving your foot. Mr. J.H.
Yes.
When I tickle the bottom of your feet, you should elicit a response of curling your toes. Did you not feel that?
I feel that, but
that's, as long as your toes are not fan out, that shows that you do not have Babinski, which is a infantile reflex. If you do, that means that you have some kind of lesion in that would cause you to have that. Okay. Normally, we would also do genital examination, but we're not going to do that today. But do you go to see your doctor, a urologist, to get a prostate exam, which is part of a health assessment, getting a prostate exam? You also need to do testicular exam to test for if there's any kind of enlargement or anything out of the ordinary with the testicles. You can do that in the shower. That is something that you can do in the shower, and that is, the testicles should move freely within the scrotum, and that is part of monthly exam, self-exam, similar to the kind of self-breast exam that women do, and that is to ensure that you're aware of what's going on in your body. Okay? Yeah. You also need to get at age 45 for African Americans, you need to have a rectal exam, colonoscopy, to check for colorectal cancer, because those are some of the things that are very popular in the black community, in the African American community. You also have to get your blood pressure checked periodically, because hypertension, diabetes are some of the things that will actually cause different comorbidities. Comorbidities are different ailments that you will find, and these are things that will create blindness, leg amputations, and those type of things. Okay. At this point in time, we're going to end our assessment. Do you have any type of questions at this point?
No, I don't. Actually, I don't.
Okay. Okay. Well, thank you for being a patient, my patient, as we do this assessment.
Thank you.
Thank you.